Good afternoon. One Health is an integrated, unifying approach to sustainable, balance, optimize the health of people, animals, and ecosystems. Health of humans, domestic and wild animals, plant and environment are closely linked and interdependent. The One Health approach mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystem while addressing the collective need for clean water, energy, and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. I wanted to start with this definition of One Health from the One Health high-level expert panel to welcome you all to this event. I'd like to thank GIZ for triggering this discussion on One Health. Today, we're also launching the joint plan of action. It's on the website. You'll hear more tomorrow in a side session at the Museum of Natural History. But really would like to hear today about the connection between One Health and real life. So we are having a series of very interesting speakers, but I would like to introduce, and I'd like them to come up to the stage. Dr. Ebere Okereke, please. Welcome. And Dr. Okereke, before you sit, why don't you give us in 1 minute your introduction? Yes, you have to.
Good afternoon, ladies and gentlemen, and those online. Thank you. My name is Ebere Okereke. I'm a public health physician. I specialize in global health security and health system strengthening and leadership development. Is that enough? Thank you.
Yes, we'll give you the chance to say more in a minute. Dr. Sunita Natarin, I believe she's connected by virtually.
Yes, I'm very much here. I'm here.
While we hear from her, I'd like to invite, oh yes, Sunita is there.
Yes, I'm here. And again, thank you so much for inviting me. I'm Sunita Narayan, and I'm an environmentalist. I work in Delhi at the Center for Science and Environment. And for me, the One Health approach is really about how do we detoxify our environment? How do we make sure that our food producing animals do not add to the health burden of human beings? And I think that's why, for me, the silent pandemic has to be linked to One Health.
Thank you. Thank you, Sunita. And can we have Dr. Andrea Winkler? Do you want to introduce yourself?
Hello, everybody. Is it on? You can hear me. Yeah. Thank you very much for the introduction, for the very spontaneous introduction. I'm very honored to fill in for Professor Wheeler from the Robert Koch Institute. So my name is Andrea Winkler. I'm the co-director of the Center for Global Health at the Technical University of Munich and the co-chair, together with John Amwesi, of the Lancet One Health Commission. Thank you very much for having me.
Welcome again. Dr. Helena Muguni. Please.
Hello, good afternoon. Is it on?
Yes.
My name is Helen Amuguni, and I'm from the Cummings School of Veterinary Medicine at Tufts University. I'm a veterinarian, an infectious disease specialist, and a gender specialist. And I really pride myself in being a One Health practitioner, sort of crossing the lines between different disciplines. I work at the community level. I usually spend most of my time with community members. So we'll be talking a little bit about that. Yeah.
Thank you. And last but not least, Dr. Jochen Flashbach.
That was last man standing. I'm Jochen Flassbart, State Secretary at the Ministry of Economic Cooperation and Development since last December. And earlier to that, so maybe most of my life, all my life, working in biodiversity environment.
Welcome again. And by the way, I didn't introduce myself. My name is Francesco Branca. I'm the Director of the Department of Nutrition and Food Safety in WHO. And that tells you why I'm interested in One Health, because actually food systems are one of the important drivers of many good and many bad things at the same time. But certainly, if we consider, for example, land expansion, the way that our food system affects ecosystem, reduces biodiversity, and also, some of our processing industries, the intensive livestock farming, or also the traditional food markets, clearly there is a big interaction between the One Health, the food system and One Health. And as I said, today we're launching this joint plan of action. I'm also at the moment facilitating the collaboration between 4 UN agencies, WHO, FAO, the World Organization on Animal Health, and UN Environmental Program that has developed this joint plan of action, which has 6 important areas. One is the enhancing One Health capacities to strengthen a system. 2 is reducing the risks from emerging and re-emerging zoonotic epidemics and pandemics. 3, it's controlling and eliminating zoonotic, neglected, tropical and vector-borne diseases. 4, strengthening the assessment, management and communication of food safety risk. 5th, curbing the silent pandemic of antimicrobial resistance. And 6, integrating the environment into One Health. So today we're going to hear from our panelists on how can the One Health approach be integrated in projects worldwide. And we will get some good examples, lessons learned, but also the challenges you have experienced in the implementation of the One Health program. And I'd like to give first the floor to, okay, forgot now the list, but I'd like to start perhaps with Dr. Amuguni. So how would you like to bring your experience here?
Okay, so I was thinking about this and I thought instead of introducing myself a little more deeply, I'd share some of the thoughts or some of the things that I think have had an impact on me as a One Health practitioner. So I call myself a One Health practitioner because I'm a veterinarian, I'm an infectious disease person, and I'm a social scientist. And all those 3, I think the thing that has had the most impact on my life as a One Health practitioner is my social science degree. And that might sound strange, but I think one of the things that it's allowed me to do is to take a step back and think about the breadth of One Health. Think about who the actors in One Health are, what their priorities are, what is it that drives them, and what are the incentives that really make them practitioners. But also on the ground, I work a lot with grassroots communities. And so I'll give you an example. I was in a country, in one of the countries I work in. I spend 75 of my time in Africa, in different countries. I was in one of the countries I work in, and there's a whole marketplace where they sell antibiotics. So I did a clandestine thing. I went to the market and I wanted to look out, who is it that's buying antibiotics? Because we are in this era of AMR stewardship. We're talking about farming, antimicrobes in farms, antimicrobes in humans and in the environment and in water. Huge One Health issue, complex issue. So I realized that a lot of the people who are coming to buy the antibiotics were women. And it makes sense. Who cares for their family when they're sick? It's the woman. They take it, the antibiotic, they buy it, they give a little to their children, the children feel better, they save it a little. When the animal feels sick, maybe their chickens are not feeling well, they put it in the water, They give it to the chicken. They collect the chicken manure and put it on the farm. And so we have antibiotics in humans, in animals, and on the farms as well. But if you think about that, at the One Health level where we are dealing, we are sort of up here. We are talking about the human, animal, environmental health issues. That person on the ground, that woman who's actually involved in a lot of these issues, has all those things in one person. They're doing environmental health, they're doing human health, they're doing animal health, and they're the actors in our One Health movie. Are we targeting them though? Most of the time, we sort of forget about them. And so just as we get into this discussion and think about this, it is really important to realize that even though we have these pillars of One Health, there is a foundation. And that foundation are these relevant cross-cutting issues that we think of: gender, social, cultural, economics, environmental, food security. All these issues sort of built into the One Health practice on the ground in the communities. I'll stop.
Thank you, Helen. No, this is great. I mean, you're clearly saying that there's a very practical side of One Health for the people in the community, and I think we need to learn that. I'd like to actually ask Sunita the main question, because it's actually not always clear how people can really bring in the environmental aspect in One Health. So what's your advice on how to bring environment in One Health projects?
It's a very good question, Francisco. And I think taking off from what Helen said, I think it's important for us to really look at the interface between AMR and the food system and climate change today. I think the biggest change that we can make and bring environment into the AMR debate with more clarity. I mean, I find today in the last 2 years, there has been movement. We have understood more and more the need to look at environment and food producing animals and crops as part of the AMR challenge. So One Health is getting integrated, but not enough when it comes to action. And the reason for action being weak in this is that we are not able to still identify so clearly what needs to be done and what needs to be done in different parts of the world. The fact, and this is why to me, the interface between climate change and AMR becomes an issue where we start looking more closely at the food systems, and the food systems being at the core of the challenge as we move ahead. We know when it comes to climate change, the intensive food systems, the amount of meat that we produce, the way we produce our meat, the way we produce our food is very much part of the climate challenge. But we also know when it comes to AMR, and for countries like mine, India, that the challenge is really about both needing to increase our food production, but also doing it in a way that we don't first toxify and then have to clean up. We need to look at both the issue of access and the issue of excess. And most importantly for us, we need to look at the fact that we need a system in which we can reuse and recycle the waste that comes out of our agriculture, exactly as Ellen said, that if we are giving it and we're putting the waste on the field, we need to do so, but we need to do so knowing that it does not have antibiotic residue. And I think this is where the opportunity is for us as a global community to really start bringing these conversations together between AMR, food systems, and the need for countries, particularly countries like mine, countries in Africa, who have still not built all the intensive food systems, to actually be able to reinvent the curve, to be able to leapfrog so that we don't first contaminate and then have to clean up. But this also means we need to take a much more critical view at the intensive food systems which are coming out of countries of the industrialized North, because in these systems, we tend to underestimate the cost of surveillance, the cost of mitigation, and the cost of contamination cleaning up. And it is because of this, we are exporting a model which is not, which is just not appropriate for the rest, for any one of us. So we need to take a critical view at things that happen in the backyards of industrial countries where food systems are, intensive food systems are thriving, and we need to reinvent the way we do things in our part of the world.
Thank you, Sunita. No, I think you are introducing a very important concept. We need to reinvent how we do things. So it's actually One Health is bringing a new way of doing things. In a sense, it's a new model of development. It's a pretty radical transformation you are suggesting. I'd like maybe now to ask Andrea how she would react to these thoughts. And you know, you have been also working in a commission on One Health. So how this good experiences are coming forward, and how can we learn about these new experiences in the way we do One Health?
Yeah, no, thank you very much, Francesco, for this question. So, I mean, as Helen has already mentioned, and the experiences that come from the ground, they should set the standard. I think this is very, very important. And also there's no one size fits all, as we all know. So it needs to be context specific. And there are a couple of C words in that One Health approach that really reflect well how we should how we should live One Health. And that is, as you well know, Francesco, it's the 4 C's, the coordination, collaboration, communication, and capacity building, mainly on the ground for various reasons. And we can explore that later on. Things then, there are other C words. Things need to be context specific. We need to strive for continuity, which is usually our sustainability, but we just made it into a C word. And important is the cohesion that we can create when we also build everything on trust, engaging the communities and the actors from the beginning, co-designing, co-advancing, co-reaping the benefits. And last but not least is really the convergence, so that if we have all of this, we can converge on important issues that we have to solve, like the decline of biodiversity, climate change, and not the least pandemics, but also, and I should mention that here, also the silent pandemic, the real pandemic, which is that of non-communicable diseases. And they can also benefit majorly by a One Health approach. And in fact, that was my port of entry. I set out 20 years ago as a young doctor in Tanzania, where I used to live and work, looking after people with epilepsy. So a non-communicable disease, you may think. But then I found that 20% of my people had cysts in the brain, so they had neurocysticercosis. And I went into the communities, and of course, I realized the freely roaming pigs and the new commercial strain that had just sprung up, which was the pig business, et cetera, et cetera. So I think we need to be vigilant, but we need to also go according to those principles, and not the least, I mean, what needs to be infiltrated and really transcend the whole One Health approach is the equity in every corner, gender equity, but also bringing the communities on board early, as I said, holism and the systems approach, not the least. Thank you very much.
Thank you, Andrea. And I'd like to go to Jochen. Maybe Jochen, from your vantage point, in having been involved in projects, in projects that have been supported by the German government, where do you think really that there is a space for this integration of the One Health approach? Do you have some success stories to tell us?
Yeah, I do, but let me first move, coming from the very concrete level on the ground, just to the mega trends. And as I said, I worked my whole life for environment and biodiversity. And I mean, what an illusion we had that we can destroy biodiversity ecosystems more or less endless in an endless way without seeing that this would fire back to us. And that's a very source. We didn't invest enough in healthy ecosystems, and that is one angle. Then for a while, I also dealt with CITES. Already we saw there that trade with wildlife trade, specifically illegal wildlife trade, is a booster for pandemics potentially. Then you have the wild markets also linked to these issues. The third one is that the whole health system was for a long time completely disconnected to this debate. Some specialists saw it, but it was not a mainstream topic. And I think this year's when we organized a G7 joint meeting of health and development ministers, it was the first time that I saw these two camps discussing about this amongst each other. So we need a holistic approach, bringing together health of ecosystems, healthy ecosystems, healthy animal welfare, and also look at it from the agricultural side. We are, Sunita mentioned it already when she spoke about what we are doing in the north, also in some parts of the south. I mean, the agriculture sector is galaxies away from sustainability. It's, if you want to see unsustainability, look at the agriculture sector. And that spills over, of course, into the health system. So what we need to do now is to integrate it on the top level, bringing the UN institutions together, bringing the national governments together, focusing on how to integrate ecosystem health, animal health, and human health together. And then, of course, this has to be reflected also in our program work. And that is something where, of course, the Ministry for Economic Cooperation and Development comes in. We are following the One Health approach for quite a while. So it is integrated already in many projects on the ground. But of course, we have to enhance it. And there it comes back that everything in a way is linked to everything. What you are saying about the skills of women. I mean, my minister and I, we are advocating for a feminist development policy, not just because we feel it's fashionable to say words like that, but because we believe that if you do not get powerful women into the solution space, then it will be very, very difficult to sustain it. And or the education side. If you have a lack of education, a lack of understanding, then people are not ready and prepared for changing their own behavior. So I don't want to make it too big, but at the end, that is the beauty of our 2030 agenda. If you don't follow the holistic approach, you will end in nowhere.
Thank you. No, holistic approach, and then you are putting really the finger on the fact that the agricultural system is really not designed in a well-hand fashion. That's probably one of the largest causes of impact on our environment. After energy, the second cause of greenhouse gas emissions is in fact the food system. So we have to change that dramatically. But let me go now to Ebere, and we didn't really give you the opportunity to say why you reconnected One Health. So why don't you start with that?
Okay, thank you very much, and thanks again for the opportunity to join this really exciting panel. So I'm a clinician, I'm a public health physician. That's my background. I started in public health as in communicable disease control and zoonosis. And I think I think it was about a week after I signed my contract, I ended up dealing with what was at the time the largest outbreak of E. coli 0157 affecting a nursery school in the area of the UK where I was working at the time. And the key thing that struck me in that experience was the fragmentation of the system. This is in the UK that has a long history of public health systems. And we didn't have coordination between human health, animal health, environment. We had an outbreak in a nursery So under the educational system, we need an environmental health officers as part of the investigation and response. The public health people were in the health sector, environmental health in local authority, and animal health in a whole different sector. And we didn't have any legislative framework, no coordinating mechanism to allow us to actually work together. So each time you came across a gap and a gutter between one professional group and the other. And that was my earliest introduction to sort of beginning to think about how do we actually bring One Health, move beyond an approach into actually systematically addressing it. And my role at the moment is around health system strengthening, and I've understood and I see the continuing tradition of vertical programs working in silos that we see across the health system also being a challenge to the implementation of our ambitions under One Health. So I don't think anybody would argue with what we say about the importance of One Health. You've articulated it from all sorts of perspectives beautifully. The challenge is, how do we move away from the ambitions, the policies, even the plans, and actually start to make a difference? Traditionally, what we do is we write a strategy, whether at national, subnational, continental level. I have been involved with writing strategies at national public health institutions, at the Africa CDC, having a continental-wide approach. And then what do? We have meetings, we set up committees, we set up task force, and then we meet for a while and we go away. And nothing changes. And that's because, so in order to actually really take a One Health approach, we have got to disrupt the existing system. We've got to break down those silos. We need to start to look at these issues, the solutions that we need to implement, and not think about which department you're working, whether you're in environmental health, whether you're in human health, whether you're working in response to climate change, antimicrobials. You need to actually have a single plan that everybody has pooled budgets, have shared performance indicators and core roles to get on and do it. Because every time that we have meetings and decide on, oh, you go environmental health, you do this and the other, we all go back to our silos and we don't actually create those solutions. So from a health system perspective, we need to stop thinking about vertical programs. At the moment, we spent a lot of time investing in AMR surveillance, very much from a human health perspective. Then now adding on, and it feels like an add-on, and I'm sure you'd agree with me that the AMR agenda in animal health seems to have been an afterthought, and the environmental health agenda is only just beginning to be discussed. So we need to stop thinking about that in our silos and actually think about the issue, the solutions we need to implement, and then everybody works collectively, irrespective of which specialty, which department, which policy unit we work in, to a single solution with a single data set of information driving a common purpose. That would be my view about what we need to do differently.
So I can see you have a lot of consensus, Ebere, on this point. Really, you've probably highlighted one of the biggest issues, is that if we want to really have One Health, as we said in the definition, we need to create these bridges among the different sectors. So these are very concrete bridges. These are not only theoretical. They are made of mechanisms, of political mechanism. They are made of exchanges of information. They are made of common trainings, for example. So I'd like to hear now, perhaps in the next round of interventions from you. How can we create those bridges? How can we be in concrete doing this common One Health? And actually, I would like to start now from Sunita, because I have the feeling that somehow the conversation on One Health has in the past excluded or kept the environment at the margin. Do you agree with that?
It absolutely did, Francisco, but I think that's changing. And I think the approach of the Quad, and I think bringing together a joint action plan is very welcome so that we can move ahead. It is very clear that the environmental pathway, the agriculture food pathway are two very important parts of the AMR challenge, and we cannot ignore it. the big issue, I think, today, and I think that's where for the action plan of the Quad and the work that we will have moving forward is to really, what is the agenda as we move ahead? I mean, what is very clear is that if you look at the issue of agriculture and you look at the issue of the food systems, the conversation we began today's meeting with, then the climate agenda and the biodiversity agenda and the AMR agenda all converge on the issue of our current food systems and what we need to do to be able to rework it, reinvent it, so that both it is affordable for the poorest, it provides nutrition and livelihoods, but it does not add to the cost of surveillance, the cost of cleaning up, and the cost of mitigation. And I use these words very carefully because I find that the biggest problem that, the obstacle that I find in the AMR One Health approach is that there isn't enough understanding of the lack of capacity and the lack of funding that is available in countries of the global South to be able to clean up after pollution, to be able to set up very expensive surveillance networks, which we just cannot afford to have. Which is why the role of prevention becomes so important for us to emphasize and to focus on. And so for me, the two immediate agendas that all governments need to really work on a One Health approach, because as Joachim said, we need a holistic approach, but we also need to take action today. And we need to act in a way that we can move this discussion ahead. So I think the first most important agenda, both for the global for the global scientific institutions, for FAO, for OIE, for UNEP, for WHO, is really to bring convergence on your understanding of the word prevention, on your understanding on how you would support countries to be able to rewrite the code for prevention so that you're not confusing the use of antimicrobials for treatment as against use for general prevention of disease management. And I think that itself becomes a very important part of us moving ahead. The second agenda that I think we need to very clearly put on the table is to make sure we have a list of antimicrobials which are too important for humans and cannot or must be minimized for their use in animals and food. And then, of course, is the environmental agenda, which is really about how do you do waste management so that it is cost effective, so that you can reuse the water, you can reuse the waste, and that you do not end up with moving a problem from one to the other. And I think, so for me, the biggest plea that I'm having, that I'm really mentioning, Francisco, is that we need to very seriously look at this agenda from the lens of countries of the global South, which very clearly know the seriousness of AMR, and they need to find ways ahead in which they don't follow the route of the global North.
So, Sunita, if I understand, so you're saying actually that now in the environmental space, One Health is understood. So is that part, for example, of the conversation in COP27 or in the biodiversity convention or not? And if not, what can we do about it?
No, it's a very good question. And thank you for coming back to me on that, Francisco. Yes, it is not understood at the mega forums, but I think it is understood more and more at the governmental level, at the national level. And I think that's where we need to begin from. But what I would argue that we have a discussion at the Biodiversity Forum on the food systems. We have a discussion on the Climate Forum on the food systems. We're not making the links adequately between food, climate change, biodiversity, and AMR. And that food then is the point at which they are all converging. But what they're really converging on is the need for reworking our intensive food farming system, which is not good for biodiversity, not good for livelihoods, and not good for nutrition, and certainly bad when it comes to AMR.
Thank you. So if I can just sum up where we are now, it seems that the main challenge is the fact that, you know, the sectors are not really understanding and including mainstreaming the One Health approach in their policies. Okay, we've heard about environment, the challenges there. Actually, I'd like to go back to the point that you made, Jochen, about agriculture. So if I understand correctly, your point is that actually we are lacking a One Health approach there. So is there any avenue you think that can be used to make that happen? What kind of transformation we need to make the One Health mainstream in agriculture?
Let me first add to what Sunita said. I'm already happy that the One Health approach is discussed at the CBD COP and in the biodiversity family. That is already a step forward. And the link to climate, the climate COP, I mean, it's a two-way track. One is that, of course, with climate change, you have new challenges for the health sector. And on the other side, again, there is a link to biodiversity. It's completely understood now. Without investing in sinks, in natural sinks, we do not have any chance to keep the 1.5 in reach. And from there, you get additional input to keep what we have, to restore, and I will come later on the restoration approach, and to ensure that the land management is sustainable. That the land use, by the way, also the marine, but it's not a big issue here, but the land use sector has to be transformed to sustainability, and it is doable. I mean, Sunita is coming from a subcontinent where low input agriculture has a long tradition, and we have to learn from that because that is the way forward. And we need to also now in the food crisis. I mean, could you imagine? Yeah, maybe you could. I couldn't. That in Africa, in the Middle East, there are countries dependent to 80, 90, 95% from imports. And most of these countries would have the capability to produce their food in a sustainable way. Not everywhere in this world. You have less privileged regions, but most of them can. But only if we change the way of production, and then immediately it would feed into a One Health approach.
But that's a big ask. Do you think that now the fact that we are, living a difficult crisis where, for example, fertilizers are less available, but actually be an opportunity or only a challenge?
You're asking me?
Yeah.
Yeah. I mean, as I worked for the environment so long, I never could imagine that I would run around in the world trying to grab some fertilizers. I would add directly the different approach, how to move away from the need of having industrialized produced fertilizers. But at the moment we are sitting in, you can't transform agriculture systems from today to tomorrow like that. So it needs a transition, but definitely the way forward is to invest more in natural ways into fertile soils. And you can do it via compost, via more circles in the crops you produce. So there are many, many approaches how to do it, as I said, with low input, but in a very sustainable way. And then you move away stepwise from the dependency of a, basically chemical determined agriculture.
Okay, so you are giving us a lot of hope. So it is definitely possible. I wonder whether economically the trend is there, because clearly the investment are still not going in that direction. Andrea, do you want to comment on the, because we just had a discussion earlier on investments. So I mean, if we want to see this alignment and these changes in policies, what are the levers?
Yeah, no, thank you very much, Francesco. And I mean, I just wanted to add quickly also to what Sura has said here, talking about these interfaces and the convergence of biodiversity, climate change, AMR, and also, of course, we have to bring in the pandemics. I think it's very important. It's another convergence. In terms of, and I come back to your question, the various entry points, the implementation now needs to run through, like we would say in Germany, like a red thread. It needs to be our common mantra now. How can we possibly implement? And we need to come from two directions. And it's okay to come from the top as well. When the top, I say globally, now talking about quadripartite and the today implemented One Health Joint Plan of Action. And if you look at this plan, it has already rather concrete suggestions for implementation. I also heard that at the moment there is an implementation manual being drafted to that plan. You can comment on this, of course, to make things more concrete. But at the same time, we need to come from the communities. And also they're already good, and we don't have to reinvent the wheel all the time. I think it's important to see what is already out there. And there are very good projects already out there that can be used also as landmarks for a One Health approach. And if we move to the national governments, and I think here we can also really learn from the Global South, because they do have their One Health offices or their One Health integration, or some of them, not all of them, One Health integration or coordination mechanisms, where we work across ministries and across implementing agencies. I'm not sure whether we need another ministry for One Health. Maybe this is creating silos again, but we do need a One Health structure of some kind that is monitoring what's happening, also evaluating. We don't have the means. I mean, the metrics to evaluate are not well developed. There are some. And as you just said as well, everything needs to be really underpinned by equitable financing. And also we are not there. And the World Bank now very, very bravely and innovatively has factored in One Health into the fifth. And I think this is a real innovation. But I already hear complaining people. So we have not been part, but it's the first step. And I think we need much more of those mechanisms that we can implement. And then maybe to add what Jochen has said as well, it doesn't come overnight. Sure, I mean, we don't have time to be patient, but some patience is also required, because we need a shift in the change in mindset. And this is also why we hear and talk. I mean, we have talked a lot about concepts. I think we don't have to talk about this anymore. We are all clear that One Health, also planetary health, I don't want to create new silos, eco-health is the way to go. But now it's about impact generation. I think we have good examples for that already, but at a small scale, not at a large scale yet. And the last thing I want to say here is really to calculate the return on investment for One Health. And there's also now a project going on from the World Bank and some UN organizations really looking at this properly. And that will give us some leverage and also some something in our hands to go to decision makers and say, look, it can work. But I think we are not quite there yet. Thank you.
Okay, so I'd like to summarize every once in a while. Okay, so we understand what the One Health concept is at last. And this concept is making its headway in the public communication. It's also making its headway in the sectoral policies. It's changing the way we consider our discussion on environment, for example. So I think we have some hopes there. We start to see some forms of collaboration, but there are elements that are limiting it. One of them is the investment in the right things. Another one is the capacities. What Andrea was mentioning is a facility basically that is being created in the context of as a result, I think, of the discussion at high level in the G7 and the G20, and it's a facility which is hosted by the World Bank, where the World Health Organization is the secretariat with many other organizations of the quadripartite who are implementing agencies. So some resources are going to be available. The public investment is there. So let's continue, and maybe I'd like now to go back to Helen. And okay, you said that some of the behaviors of the people are probably not contributing to One Health. So can you give us some ideas, suggestions, your vision about what can actually happen at community level to change this approach, this behavior? What would be needed? Is it a matter of, explaining things? It's a matter of awareness of the population? Is it a matter of creating the opportunities, the context? So for example, you mentioned incorrect use of antibiotics. What do you think needs to be done to implement the One Health concept at community level?
I think maybe just starting with the idea that One Health already is in action. I would argue that there's so many groups that have been created that are doing One Health at national level. There's so many platforms. If you go to many countries in Africa, they have national One Health platforms that are coordinating platforms. Already they exist. They've been doing a lot of work. And so it's an issue of, first of all, just bringing those together. I would say with One Health, we need to move forward and not keep reinventing, getting more platforms, getting more groups being formed, but take advantage of what already exists. But at community level, when you're working with farmers, when you're working with local men and local women, they don't care about One Health. That's not a term that they will, they'll be thinking of, because they're thinking, I'll give you an example. They'll be thinking, what does it cost to vaccinate your dog? Most of you probably have pets. What does it cost to vaccinate your dog? $20. What does it cost to vaccinate you when you're bitten by a dog? $1,000. There's a huge difference. And so when we're working with the communities, we are looking at that. What's practical for them? What is it that can change their lives and their pockets and put food on the table? So there are a number of policies that come from up, the policies that One Health policies at national level, they already exist. Silos are being broken. It's a big thing, honestly. And there are One Health policies in governments, they're not trickling down to the community level. And one of the reasons is because they're not aligned with what the community thinks. And I'll give you an example. One of the countries I work in, it's illegal to hunt wildlife. It's illegal to hunt bats, or the community I work with, they hunt bats, they eat bats, they cook bats, so there's such a disconnect between the national policy and the policy on the ground, If that could change so that these two groups from the bottom and from the top are working together, that's a huge change that would happen. Just being able to, I come from the point of view that the community really knows what they want. They are the actual change makers as far as One Health is concerned. That woman that I talked about, she's the one responsible for antimicrobial stewardship. It will not be someone in an office somewhere. Their pandemics happen at that community level. That's where the outbreak will happen. And if that community can be able to buy into that, the only way they can begin to buy into that is to understand this, how important it is, and that their priority is important to them. One of the other things, just to give an example, is maybe we need more One Health practitioners on the ground. A lot of the time, right now, there's so many One Health Masters programs that have been, I think it's a great idea. But I think we are forgetting that the people on the ground, most of them are veterinarians, medical doctors, nurses, and these people, if you can't take all of them and take them through a One Health Masters program, they have to practice One Health wherever they are on the ground. So they just need skills, train them, give them some skills, they acknowledge they know how to coordinate, use the C's that Andrea is talking about. How can they collaborate? If they're going, in Uganda, there's an outbreak right now. What are the economics of that? One of the simple things that you can do is, as they're planning, and they're doing this, Uganda has done this really well with the National One Health platform, with the Emergency Operations Center, is they sent out teams, and those teams will include veterinarians, medical doctors, environmental scientists. In the evenings, they'll have a meeting and they'll coordinate actions, So those are some of the practical things. I think we must involve the private sector. We've forgotten about the private sector in the One Health space. And I think private sector, both non-governmental organizations as well as businesses. I come from Kenya originally. And when the outbreak happened in West Africa, the Ebola outbreak, Kenya Airways lost 1 billion Kenya shillings. And if you had told Kenya Airways before that they needed to get involved in pandemic preparedness, they probably would have said no. But right now, if you go to Kenya Airways and you say, hey, can you be part of pandemic preparedness? They will be. A lot of private sector partners are willing to partner and put in the funds that we are looking for to be able to help out with One Health. Yes.
Very, 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 very concrete. So it's getting the community much more engaged and getting some other actors, such as the private sector, much more engaged. Can I ask you something? WHO recommends that the sale of live wild animals in traditional market is banned. And some people believe that actually this is a problem for the livelihood of some people. How would you comment there? I mean, how would you implement this recommendation?
I don't know. I feel that the recommendation would probably fail. I mean, why? Because this is my opinion. Why? Because when we say this is banned, and we haven't talked to the community, we haven't worked with them. Why is it? Back to my initial question, what is it that drives a community to do certain things? Most of the time, it's food security. I mean, it's a livelihood for someone. So we can't just say, ban this, because we're taking away people's livelihoods. We have to figure out an alternative and then work with that community and come up with that alternative. I give an example. Back to my women in the community, we say, you know what, deforestation is a bad thing. Don't cut down trees, because when you cut down trees, you destroy the environment. But I have the privilege of going into my house and turning on the gas. They don't have that. They're thinking about today, putting food on the table today to feed their families. And so if I'm saying you can't use firewood, I don't have any alternative for them. I have an alternative for myself because I live a better life, then how does that help? How do you work to be able to address their need that they have today so that we can solve tomorrow's problem? I think we really have to think from that perspective. Yeah.
Thank you. We would like to give you the opportunity to participate. So maybe the third round of question will be triggered by you. So think about your question. But before then, I'd like to give again Ebere the floor to comment on a point that was mentioned by Helen. She said, we actually have a lot of workers on the ground, but if they can work together to implement this One Health concept, we would be able to achieve a lot without having a new a task force on One Health. So that could be one very concrete way to build the bridges. What do you think?
I'm going to just step back a little bit, and all the issues and points that my colleagues here have mentioned, I find a single common node that connects all of them, and that's the center of government. You talked about the challenges of agricultural development. What is the challenge of agricultural development? It's food safety, food security, and economic growth. What is the challenge with environmental contamination? Again, it's in industrialization and economic growth. The challenge isn't the individual problems, it's center of government, and therefore the solution has to sit at the center of government. We need in every government of varying quality, but their whole objective is the growth, the development of the countries that they lead. And they make decisions about how they grow the economies, and they provide the security so that people have food security and don't need to cut down firewood to heat or cook their food. The whole purpose of effective government is to deliver those solutions. Now, if we put One Health in the center of all those development initiatives, that's when you create the ecosystem that ensures that we don't have to start thinking about downstream damage limitation, but actually build in prevention before we start to develop these new industries, before we move away from food products for food into, agriculture for commercial purposes, and how we do that. The solution has got to sit at the center of government. Now, that doesn't take away from the community level engagement. Like you said, we do need to have bottom up, but the top down has also got to work. And that does require government seeing, and I'm going to be a bit controversial here. The problem with One Health is the term health. Center of government do not see health as a priority. The health minister doesn't traditionally sit in the front of the room in a cabinet briefing until the pandemic. So we have an opportunity now. Everybody traditionally saw health as something that takes funding, it doesn't deliver. But the pandemic has showed us if you don't get your health right, development has been, we've seen the SDGs rolling backwards. We've seen all sorts of development initiatives rolling backwards. So there is an opportunity here to actually start to put health as core business for government, and that health should be One Health. If you're talking about investment in your economic growth, you need to be looking at it through a One Health lens. So you're anticipating the potential consequences of any initiatives you're doing and planning and rolling back from them. In terms of, we have the people. We are training people on the theories that, like you said, the Masters of One Health programs all over the place. But the real implementation is at the ground. And any plan to ban wildlife poaching or hunting that doesn't consider how are people going to eat isn't going to work. And we know that. So the center of government's responsibility is, how do my people eat, thrive, and succeed? And if we put One Health into the foundation and make it a part of central government delivery to say, everything that we're doing for economic growth, for our development, has to be seen and delivered through that One Health approach, that is when we start to see those sustainable changes that go beyond the committees, the policies, the task forces. It becomes a way of thinking. It gives the animal health specialists, the environmental health scientists, the same legitimacy as the Minister for Finance in saying that thing might produce a growth in your GDP, but the consequence of the environmental damage is going to cost you this much. We've got to compromise. That has to happen at central government. It won't be led by health ministers. It won't be led by Minister for Agriculture. It won't be led by the community, even though the community are part of the solution. It has got to be a central government delivery priority.
So I better paraphrasing. Paraphrasing what Helen was saying, so now governments with the pandemics have learned they need to invest those $10 in prevention, because otherwise they're going to spend much more than those $10 in the effects of that. Yeah, thank you. So, okay, does anybody want? Sunita wants to come in. Sunita, come in. But we can't hear you, Sunita. Yes, go ahead.
So just two things. I think the very key word is prevention. And I think that's where we need to keep the focus on, because prevention, when it comes to the WASH agenda, when it comes to clean water and sanitation, becomes so important in terms of antimicrobials. It's also very important from the point of view of women, women's health, women's labor, women's time to provide clean water and sanitation. Prevention is very important when it comes to the environmental agenda because of the cost of surveillance, the cost of treatment. And prevention is also very important from the food producing animals. And I think I just wanted to point out to the point that you had made in terms of WHO and other institutions talking about not keeping live animals. I think it's also important for us to understand, and that's where the deep dives need to happen now. That is that the source of the problem, or are we really missing the boat? Because the real problem is not just in the animals that the poor keep, but the animals that the intensive food systems keep, but they're able to somehow manage the system in a way to make us all believe that they are clean because they look visibly cleaner. And I think that's also where some of these debates need to go. So I just wanted to butt in on this. Thank you.
Thank you, Sunita. Just to clarify, you mentioned prevention. Of course, you mean prevention of pandemics.
Yes, I do. Prevention of pandemics, but I also mean prevention in terms of the key agenda when it comes to linking AMR with the One Health approach.
Right, because we can see, of course, One Health is about prevention of pandemics, but One Health is about ensuring One Health. And we in WHO say that health is not only the absence of disease. So again, if we want to see a One Health concept, we need to think of a planetary health that goes beyond simply the prevention of disasters. Anyway, just to clarify, and I'd like to, continue on this topic of prevention. I wonder whether there's anybody from the audience who wants to come in and make a comment or ask a question. So we have a lady there. But on prevention, I just want to say that there is a discussion, as you know, at the moment about a pandemic instrument, and prevention is definitely a question, an issue that has been raised. But we need to clarify what prevention means. We know that One Health is a very important element of that prevention, but we need to be specific of what we mean by that. I hope that will come into discussion now. But please, you want to give the... If you want to introduce yourself, please.
Hello. First of all, thank you very much for a really interesting panel. For me personally, because this is a significant opportunity for me to really understand One Health. Introducing myself, my name is Goshan. I am a public health specialist from Kurdistan, from the northern part of Iraq. And I suppose my question to anyone in the panel who wants to take it is specifically, One Health, unfortunately, is something that in my part of the world, we're not hearing much about, which is something that seems to be strange to me because it seems it's the running theme of this year's summit. My question specifically is, to what extent do you think One Health incorporates or considers the Middle Eastern perspective? And then also, to what extent, again, related to the Middle Eastern perspective, do you think conflict plays a part in the One Health dynamic? Because I think that the combination of human, animal, and environment is highly related to conflict and instability. And to what extent has that been incorporated in the plans, or do you think it's relevant in any way? Thank you.
Thank you. Andrea, do you want to take this question? So I think it could be a what is the understanding of One Health around the world? What do you have any feeling about that?
Yeah, no, thank you very much for this interesting question. Also to bring in the conflict side, I maybe answer to that second. So, I mean, One Health is just a concept that is it's old, as we just discussed before, Francesco, but it has been really coined by the veterinary sector. And it has been really the interaction between animals and humans, but more from the zoonotic perspective, so disease transmission. Now, these days, and also through the pandemic, the concept has widened. It very often just means cross-sectoral collaboration for a specific targeted issue. So that convergence of various ministries or institutions, let's say for climate change, biodiversity loss, or for pandemic prevention. I was just part of a discussion of a regional European and Central Asian meeting from the World Organization for Animal Health, and we had all the representatives there, and we discussed the One Health concept. And it was known, I would say, it was taken on board to 60–70% of the delegates. So what I want to say here, it's that it's starting to trickle through, and it's really on the ground. This is a concept that is driven by vets, and the human sector is only starting to come in. Interestingly, at the global level, it's what we heard as well from the AMR surveillance. I think you mentioned it. It's very focused on the human side. And so there is that gap that still needs to be reconciled. So it's up really to your government to take up that issue, but also to the global players and the local players to enforce it. And conflict, you're right. I mean, conflict is very, very often used to instrumentalize specific, like, you know, not having vaccination reached people, etc. We also know through conflict that with the heavy metal in the ground, it can actually exacerbate AMR, and that there's quite good evidence for this now. So yes, conflict definitely plays a role. Also, the trafficking of animals, etc., is definitely increasing. So conflict will worsen a One Health approach for sure, definitely also because the collaboration and communication is less, and it will be more polarized. So I think you have a very good, especially with the conflict, it's a very good point that you've brought up. Thank you very much.
Thank you, Andrea. I'd like now to go to Joachim again. And we were talking about prevention, and there's two efforts. One is the quadripartite that is working on this joint action plan. And then, you know, what I mentioned, the discussion the member states are having about the pandemic instrument. Now, from your experience, from your point of view, what would you like to ask these two groups to do? So where you think the energy of the UN should go in, you know, strengthening the One Health agenda, and what would you suggest to member states to include in an instrument, in a treaty that would then enhance pandemic prevention?
I mean, it's already a lot of progress that we are going into the direction of quadripartite, and to check where are the challenges. And I learned, I didn't know it from my briefings, that there is already a data problem. So how to link data from the different sectors, from veterinarian side, from the human health, but also from the environment side. So I think it's very good that UNEP now joins this cooperation, because they have tons of data, and I think it's doable to link this data together and make something meaningful out of it. I think that's very relevant. And the second point I want to make, it's a bit about the UN, but also about the scientists. Many scientists are here at the World Health Summit, and those who, I said it already this morning in a panel, those who listened yesterday evening and had the chance to listen to Chancellor Olaf Scholz. I mean, I doubt that many prime ministers' office know about anything about One Health. And also, although, of course, my chancellor knows more or less everything, but also there might be a lack of information. But he said very explicitly yesterday that he needs the scientific advice. He's a strong believer in science policy interfaces, and that is what is needed. And then it triggers down. Of course, you have the community level, but you need to have, as you said, an understanding at the central government, and it's not coming from the universe. Somebody needs to explain this, and we have had a lot of experiences here in Germany, and I think we were in a beautiful situation with all the scientists we have here in Germany, and their connection to the international scientific scenery. So we made something out of it. Of course, we made also during this pandemic some mistakes, but wow, what would have been without this scientific advice? So a very strong, call for making available what is on the UN level, what is in the different scientific sceneries, and also on the ground is there as knowledge to advise central governments to bring them into a position to make a well-informed decision.
Thank you, Jochen. Okay, so that's a very clear task. We have to bring together the scientific community and help them advise politicians in each of the countries, because, as you say, they all need to be on the same page in the understanding. Okay, good, thank you. And maybe, Helen, from your point of view, what would you like to ask the UN organizations to do, and what do you think the member states should include in the pandemic treaty?
I think before the quadripartite, there was the tripartite, and the UN and FAO are really good coordinating bodies. We've seen impact on the ground at country level. They have a voice, they are respected. And so using that opportunity to be a coordinator, to be that convener that Andrea was talking about, to bring these different groups together. Most government ministries, most government officials will react well to WHO, to FAO, to OIE, UNEP, if they come to them together with one voice. So I think that opportunity to act as that convener would be really, really important. I think also the opportunity to fund or lobby for funding, because everyone thinks UN has money. So maybe taking those funds and actually using them and putting them in developing and supporting countries to build their One Health structures, because that's also lacking in many places. We have this, like I said, many countries in Africa have these national One Health platforms that don't have funding. But the UN or the quadripartite might not be able to provide the funding, but it can lobby. It can lobby for the right funding because it has a voice. It can be able to lobby for the right funding to be applied to these different countries or different issues that are happening. So I think that role is really, really important. It's already being played by these 4 organizations to some extent, but doing it together now with one voice is going to have a really big impact. Yeah.
And what would you like to see in a pandemic treaty?
In the pandemic treaty, I want to see community engagement play a really big role. I want to see stakeholders from the bottom up really having a voice. I'd like to be able to see feedback. I think that's one of the things that lacks. A lot of the times, things are organized. People say they're listening to the communities, and then they go and make decisions. There's no feedback back to the community on what is happening. But that really has a big impact. If you go and talk to a community and then you come back and you do what sometimes we call synthetic sessions or playback sessions and say, is this what you thought? Is this what you'd like to see happening? You get buy-in straight from there, from the beginning. So I'd like to be able to see them being included and having their voice heard in this. Yeah.
Thank you. Thank you. Okay, now I have a lot of hands now. I have 1, 2, 3 and 4. So the gentleman on the left. I still need to ask Ebere what she asks us the quadripartite. So maybe in one of your replies, please tell us. Please, and identify yourself.
Thank you very much. Somebody injected the name of UNEP, so I had to do the honors. First of all, your question on what should be included in the pandemic treaty, for example, I would love, or we would love to see the right to.
Can you put your mouth closer to the microphone?
The right to a clean, healthy, and sustainable environment as one of the principles for the new treaty. Then in terms of One Health, I hope people are not going to deal with it as a topic or a theme. This is an integrated approach, just like the way we are implementing the 2030 agenda. It is an integrated approach to a problem that we have. Second, environment has been the neglected child, but it's wonderful that it is now one of the action tracks, particularly number 6, that is dealing with how do we better integrate the environment into One Health. Janet, Helen talked about behavior insight, behavior science. I think that is wonderful. We need more of that. I give you a perfect example. Our behavior brought COVID. Our behavior spread COVID. Our behavior most likely will slow down or stop COVID. And then back to the basics, prevention at source, prevention at source. Just like WHO, primary healthcare is your darling, that is wonderful. But also we need to make primary prevention at source. That means land use change, deforestation, biodiversity loss. How do we make them the central element of this conversation? Do we need a One Health ministry? No, we don't need that. But what we need is to better incorporate the priorities of the ministries of natural resource, forestry, agriculture. If you can do that at the national level, then that's really a real integrated approach. It also a win-win situation. You are not really implementing the mandate and priority of another organization, but you're actually collectively reacting. And finally, we have something called Nature for Health Initiative, thanks to Germany, where put a good amount of resources into that. One of the things we're trying to do is actually how do we build capacity at the national level on One Health and environment.
Thank you. Thank you, sir. So there's a gentleman there. Yeah, please, the gentleman there. In the corridor here. Then I have another 2 people. I'd like to leave the last minute to each of the speakers. So please think of what your key take-home messages will be. Please.
Thank you for giving me the floor. So I come a little bit late, but I would like to say something. I am.
I'm sorry. Would you like to tell us who you are?
Yes, I'm Papa Sek. I am the senior technical advisor to the President of the Republic of Senegal in charge of animal health and global health security. Basically, I'm veterinarian. So I consider myself as One Health leader because I am one of the pioneers which established the One Health, who implement the One Health in Senegal. And talking about the need of high-level commitment from the government, I should say that in Senegal, we established from the Prime Minister Cabinet the High Council for Global Health Security based on One Health. And that was very key for us to be able to implement the One Health approach in Senegal, having all actors on board. I mean, the sectors, but also the non-health sectors. Because from my view, I think that One Health is beyond health, because we need to have those are on the ground, being in contact with the communities. I mean, the community health workers, I mean, the socio-anthropological actors, etc. So that is really a key thing that we have to succeed. So talking about the tripartite, I would like to say them. They have to implement on the ground what they establish globally. It is very important because the field of work in the One Health approach is not in the global level. It is on the ground with the communities. So it's really a demand. And I think that you should think about it. And as Madam said, you have to fund those who are on the ground working with the community to be able to prevent any health crisis, because all is about preparation, all is about preparedness, all is about prevention. And the One Health is a great opportunities for humanity to be able to put good model of prevention, but also of preparedness in regard of health crisis. Thank you for listening, giving me the floor. Thank you.
Thank you. Thank you. And we have a gentleman and a lady.
Thank you very much for the opportunity. My name is Musa Al Hassan Kroma. I am from Liberia, and I am the founder and CEO of the Popular Health Foundation of Liberia. One Health is actually a topic of interest to me because in 2015, I lost my little brother to a dog bite, and it greatly affected my life. It shifted my thinking for so many things. And currently I have great interest in health because I don't want other people to go through such things that I went through. So my question is, most of you have talked about One Health at the parliamentary level, at the government level. What I want to know is, what are your recommendations on how we can acknowledge people, make awareness in the communities to let the people know in the community what is One Health and how they can protect themselves from One Health diseases? And secondly, what we recommend in incorporating One Health into school curriculum, especially primary schools and junior levels? Thank you so much.
Thank you. And last question from the lady there. Oh.
Hello, everyone. Thank you for this opportunity. My name is Christina. I'm originally from Greece, and I'm the president of International Student One Health Alliance. We do have members from all around the world. We do have pharmacy students. We do have agricultural students, veterinarians. So my question is how you see our involvement and where we can get the opportunities to be involved in community sectors, in even like changing the curriculum of our universities. For example, we in Greece, we didn't have that many topics and sessions regarding One Health. So yeah, this is my question. Thank you.
Thank you. And okay, last comment there.
Thank you. Sebastian Schöner from Leipzig University Hospital, infectious disease clinician, and interested in AMR. The need for private sector involvement was mentioned, and I'm generally interested, how do you want to hold them accountable? And then more specifically, Sunita talked about the food sector, and obviously this is hugely important for AMR. And you mentioned the preventative use of antibiotics in that sector, and I'm wondering, how do you want to actually enforce that antibiotics aren't used preventatively? And you didn't mention this, but they're still used for growth promoters, including colistin, which is absolutely a last resort antibiotic. How can we enforce, even if laws are there, that this is truly not used anymore with weak regulatory capacities and so on? So yeah, thank you. And thanks for the panel. This was great.
Thank you. Okay, very interesting, important points. Probably in the final statement, they can be addressed by our panelists. So particularly ones around community can be answered by Helen, and maybe Andrea, if you want to comment about the private sector. But we'll give 1 minute you each, and we'll start from Sunita.
So I'll take the last comment. I think very important. I mean, the Achilles heel of most governments is regulatory control. But I think it's also important for us to first start with at least making clear that there are certain things that we cannot and must not do. And I think that's where the issue of prevention and growth promoters has to come in. You know, I'm a member of the global group on antimicrobial resistance. And, you know, when we began our journey, and making the links between food producing animals, environment, our first focus was growth promoters. But we very quickly learned that it's not just that, because the word growth promoter can easily be used for prevention, and we can still do the same thing and continue to create a huge problem. So we need to understand this. We need to make sure that that critical group of antimicrobials for humans there is a clear list, and it is available to all governments so that we can make sure that this is not allowed. And I think for us as the global group now, the priority, and I think the priority that we've discussed today really comes together to say, we know today that there are linkages, but what we now need is to come up with a clear agenda and an action agenda in terms of what needs to be done at the national level and at the international level. And that's what we all need to work on.
Thank you. Thank you, Sunita. Helen, your minute.
Okay. Maybe I just touch on the questions. One about community level engagement. I think maybe we can talk a little bit after this. One of the things that we've done for the students is, I don't know if you go on the website and look at Africa One Health University Network, they have students for One Health in every institution that they're in. And these students actually go out into the field in different disciplines. They'll take a medical student, veterinarian, environmental. They go out and they do projects together and they do work together. By the time they graduate, they're very much aware of One Health, of coordinating and working together. So that's one of the things that's already happening. And so just maybe being able to link them up. I think for me, one of the most important final things is being able to go to where I started from, understanding the breadth of One Health and understanding the non-traditional partners that we have to bring into One Health. We have the pillars of human health, animal health, environmental health, and plant health, but those are underpinned by all these other social scientists, economists, environmentalists, gender specialists, all these people who really are non-traditional. We'd call them non-traditional One Health practitioners, but they play such a big role. How do we make sure that we are bringing them into the fold? We don't wait until the last year to do what we have done with environment. We bring them in early because we know that we can only achieve things if we are working together as a group. Yeah.
Thank you. Thank you. Jochen.
Yeah, I just want to limit myself on one thought, and that is prevention. And Christian Drosten here from Berlin once said there is no glory in prevention, and that's very right, and that's a political obstacle. In a situation of a disaster, people understand that there is a need to act, and they have the capability to forget it the next day. As on many levels, starting with biodiversity loss, also with sanitation, access to clean water, to sanitation, all this is needed. All this needs political attention. All this needs financing, by the way, and this triggers down to the community level. The examples you gave also on that level, people need to better understand that prevention is much cheaper than paying the bill afterwards.
Thank you. Ebere.
Thank you. One question, comment, and then to also pick up on the question there about conflict, and then my final comment. So conflict is part of the social dynamic aspect of One Health, and a critical contributor, I think, to challenges that we face, because with conflict and we have people movement and loss of traditional systems of farming, for example, which result in changes in practice that might have adverse effects on the environment, on food, on water safety, etc. So in thinking about One Health, we have got to look at the sociological factors that contribute to changes of behavior at a population scale. So it is definitely a core part of that. The other comment I wanted to make was on actual access of the availability of the data to inform the actions that we make. Now, there has been a significant contribution. There's been a tradition of significant investment in information from the human health perspective. There's increasing investment in animal health perspective, but data on environmental health factors, environmental impact of some of our practices that are related to One Health is only just now beginning to emerge. So at risk of being a turkey voting for Christmas as a public health, human health practitioner, I would say that we need to invest more in the other aspects of One Health, in environmental health, in veterinary sciences, in social anthropology of human behavior, so that we actually have a comprehensive system of information base on which to base the actions we take at national level. And then in closing, my point is very much that One Health isn't a nice to have project. We need to stop thinking about it as a project. We need to think about it as an essential way of thinking for any nation's health security and social and economic development. And then if the sort of current experience of climate change, of demographic change, some of it due to climate and people movement, the increased connectivity of human activity, annual and environmental health interfaces that are changing, means that the coordination that One Health defines is essential to the center of government. And it is mandatory. We need all government, center of government, any government thinking about implementing the SDGs must be looking at it for their country through a One Health lens. So the evidence that One Health is important is incontrovertible. I think everybody agrees that it needs to be done. The challenge is how we then translate it into deliverable mechanisms on the ground. And in my view, much as I have personally been involved in the creation of One Health platforms, I think those platforms need to be brought back into central government. And that is the delivery mechanism we should be looking for.
Thank you, Ben. And Andrea, your last word.
I understand we are over time already, so I'll be really fast. I mean, much of it has been said already. I really love the One Health practitioner, but I would like to advocate for the One Health practitioner, not only in the global South, but also in the global North. But here again, you have to talk to people, to patients, and that is not accounted for by medical insurances. So prevention is based on talking, and our doctors don't get any reimbursement for that. I think that is a very critical point for the global North. One Health, the gentleman over there, it's not a discipline, you're absolutely right. It's a means of integration. It's a concept of integration so that we can converge on specific topics. The young lady over there, definitely we have in our discussion left out the young generation and the civil society, and they have a huge impact in driving the One Health agenda forward. One Health knowledge generation and sharing is key, needs to start early on, and until very late in life as well, needs to be locally, regionally, globally. And I think I just stop here. We shouldn't stop talking about One Health, but we also need to start implementing One Health. Thank you very much.
Thank you, Andrea. So with this, I really would like to thank all the panelists and the speakers. Thanks for your interaction, for being with us. Enjoy the rest of the meeting. Goodbye.
Thank you.